porte-parole aujourd'hui dans l'ordre suivant sont la médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'honorable Blaine Higgs, Premier ministre du Nouveau-Brunswick. Dr. Russell.
Thanks, Bruce. Merci à vous, citoyens du Nouveau-Brunswick. Au cours des 2 dernières semaines, des milliers de nouveaux Néo-Brunswickois ont fait des sacrifices et ont dû surmonter des épreuves ardues pour le bien de l'ensemble de la population. Ces dernières semaines ont été difficiles pour tout le monde et je tiens à ce que vous sachiez que vos efforts ont amélioré la situation. Alors, un gros merci. Thank you very much to all New Brunswickers. Over the last 2 weeks, thousands of New Brunswickers have made sacrifices and borne hardships for the good of all of us. This time has been challenging for everyone, and I want you to know that your efforts have made a difference. By staying within your one household bubble, following public health guidance, and getting vaccinated, you have helped us blunt the impact of this latest wave of the COVID-19 pandemic. You have helped us to slow down the rise in hospitalizations and enabled our healthcare system to better manage a very difficult situation. Over the past 2 weeks, New Brunswickers have stepped up for our province. Your actions have given our public health team the confidence to recommend to Cabinet that the province return to Level 2 in our COVID-19 winter plan. This does not mean we expect only smooth sailing ahead. We are still in the midst of a storm which will continue for 2 to 3 more weeks at least. But the data shows a clear trend toward reduced pressure on our healthcare system thanks to the efforts that you have made, not only with the public health guidance that we've provided that you've been following, but also with people who have stepped up to volunteer, people who have stepped up to get vaccinated and boosted. We will need continued vigilance and a cautious approach in returning to school, work, and everyday activities. We need everyone to continue getting vaccinated and continue getting boosted while you are eligible. When you are eligible. Getting fully vaccinated and boosted offers the best protection against moderate and severe illness due to COVID-19, as well as reduced hospitalization and death, as well as reduced transmission of the virus. If we can carry on in the spirit of that New Brunswickers have shown over these past 2 weeks, we believe the impact of this wave can be managed. Aujourd'hui, 141 citoyens du Nouveau-Brunswick sont hospitalisés en raison de la COVID-19, dont 8 aux soins intensifs. Today, there are 141 New Brunswickers in hospital with COVID-19, and of these, 8 are in intensive care unit. When New Brunswick went to Level 3 on January 14th, we were responding to a dire situation in our healthcare system. If no action had been taken at that point, we expected to have over 220 COVID-19 patients in hospital by the end of January. But because public interaction was reduced, the spread of the virus has been less aggressive than the worst-case scenario. So on this first slide, you will see the scenarios that we expected for hospitalizations. The yellow line represents our predictions at mid-January if no action had been taken. And the lines below it show what we could expect with either a 10%, 20%, or 30% reduction in person-to-person contacts. And as you can see, the dotted line represents the actual incidence of hospitalizations since January 1st. And you can see that line is tracking very, very close to that 30% reduction in close contacts. This shows that your efforts to reduce contacts with others are paying off. So with that reduction in contacts over the last 2 weeks, we now expect the peak of about 150 hospital cases will be reached in mid-February. Again, depending on what curve we follow. So hospitalizations will continue to rise over the next couple of weeks due to anticipated activity and more public contact under Level 2. So you'll see in this slide that we are seeing another positive indicator is a downward trend in daily hospital admissions for COVID-19. So while any patient with COVID-19 requires special attention, We know that many of our current hospital patients test positive after being admitted or on admission for another health issue or acquire an infection after admission. Hospital admissions for COVID-19 are a barometer for the severity of illness in our communities. In this graph, the black line represents the 7-day rolling average for COVID-19 hospital admissions. And as you can see, this line has peaked a week ago at 18 per day and has been on a slow but steady decline since then, which is a very good trend, and it's what we were looking for and hoping to see. Les mesures que vous avez prises nous ont toutes permis de limiter le pic du nombre d'hospitalisations et de retarder les répercussions connexes de quelques semaines, donnant à notre système de soins de santé du temps précieux dont il a grandement besoin. At level 2, there will be fewer restrictions and more opportunity for movement and interaction. Please use this prudently. Limitez vos contacts aux membres de votre ménage, votre groupe, plus votre groupe de même 10 pour les rassemblements à l'intérieur et à l'extérieur. Le port du masque demeure obligatoire dans tous les espaces publics à l'intérieur ainsi qu'à l'extérieur dans les endroits où il est impossible de respecter les consignes de distanciation physique. Limit your contacts to your household plus a steady 10 for indoor and outdoor gatherings. Avoid poorly ventilated and crowded indoor spaces, particularly if you are not fully vaccinated. We know the virus spreads quickly in these locations. Masks remain mandatory for all indoor public spaces and outdoor spaces where physical distancing cannot be maintained. Public venues such as theaters, cinemas, and hockey arenas will be able to operate at 50% of their normal capacity with proof of vaccination. Patrons must remain masked and seated at all times except when eating or drinking. Les commerces de détail peuvent ouvrir à 50% de leur capacité. Les restaurants peuvent ouvrir des repas à manger sur place pourvu qu'ils fonctionnent à 50% de leur capacité et exigent une preuve de vaccination. Les gymnases, les spas et les établissements de soins personnels peuvent également rouvrir leurs portes pourvu qu'ils fonctionnent à 50% de leur capacité et exigent que leurs clients présentent une preuve de vaccination. Retail businesses can operate at 50% capacity. Restaurants can open for dining in at 50% capacity and proof of vaccination. Gyms, spas, and salons can also reopen at 50% capacity and proof of vaccination by customers. The return to level 2 will also see the resumption of in-person learning at our schools. As a parent, I know how important it is for kids to be in school right now and how worrying the return to classroom learning is for parents, teachers, and children. School is the best place for kids physically and mentally. There are risks in the return to school, but I am confident those risks are manageable. When our children return to school, we also want to see them return to play. Sports and music are beneficial to our mental and physical health, and that's why we have modified Level 2 rules so that these activities can resume in a way that limits the spread of infection. This is all part of the balance we must continually strike to limit the spread of the virus and at the same time enable everyone to maintain a healthy, fulfilling, and balanced life. To those who may feel the changes for sports activities and music may not go far enough, I want you to know that my team is continuously working on ways to gradually loosen restrictions while we ride the crest of this wave. The actions taken this month were difficult, but they were necessary. These measures have been effective, not to end the pandemic and not to end this particular wave, but to limit its impact at this critical time. We have the skills to live safely with COVID, which will be our focus in the weeks and months ahead. Avec la fin des restrictions de la phase d'alerte 3, les citoyens effectueront plus de déplacements. Ainsi, le nombre d'infections à la COVID-19 augmentera, entraînant davantage de maladies graves, d'hospitalisations et de décès attribuables à ce virus. But because of your actions, the peak will not be as severe as we first anticipated. And the healthcare system is still in for several challenging weeks, but we believe this is manageable. And that's because of you. Thank you very much. Merci beaucoup.
Bonjour. Good afternoon. Since the pandemic began, we've been continuously refining our decisions based upon new information and a better understanding of how our own ability to manage the spread of the different variants of COVID-19 virus. That preparation meant this includes being cognizant of the impact on people's ability to live their lives and their willingness to adhere to public health measures. Moving the province to level 3 phase of the winter plan was necessary. Cela nous a donné le temps nécessaire pour ralentir la propagation de variant Omicron, afin de nous préparer à faire face à des défis que nous n'avons jamais vus auparavant dans le système hospitalier, en raison de la nature très contagieuse de variant Omicron. That preparation meant increasing the number of people receiving a booster dose, particularly of those who are at the highest risk of serious illness and hospitalization, meaning those who are over 50 years old and with underlying conditions, and to get more children aged 5 to 11 vaccinated. New Brunswickers once again stepped up with more than 115,000 people getting their booster doses since January 10th. Today, 41.3% of eligible New Brunswickers have received a booster, which is good, but we have room for improvement. This includes 65.6% of those aged 50 and older and 75.5% of those aged 65 and older. To date, 55.5% of children aged 5 to 11 have received their first dose of vaccine, and 4% have received their second dose, and more are coming forward every day. Even with those positive strides forward, there's always room for improvement, and vaccine capabilities have not yet been reached. We indeed can vaccinate more. We still are not fulfilling all of the available appointments. Nous savons que le nombre de cas et l'hospitalisation va continuer d'augmenter et que d'autres personnes vont mourir en raison de ce virus. Those are the greatest risks are people who are not vaccinated or partially vaccinated or did not receive their booster shots at 6 months, and who are also over the age of 70 and have a pre-existing risk factor, such as hypertension, cardiovascular disease, or diabetes, in which COVID has then exacerbated the situation. Those cases have accounted for 76% of our deaths from COVID-19 since December 1st. Of those that were under the age of 70, 86% of those who died were not fully protected. We realize that we have had a high number of deaths in recent months, especially compared to previous waves. When the Omicron wave began, we still had a significant amount of the Delta variant in the province. Of those cases that were able to be sequenced, 43% had Delta. We know that Delta had more severe symptoms and a higher death rate than Omicron. As well, 96% of those who have died since December 1st had an associated risk factor, such as an underlying health condition, or they were not fully protected by vaccinations. Ces statistiques continuent de montrer l'importance d'être vacciné et de respecter toutes les mesures de la santé publique, en particulier pour les personnes les plus à risque et celles de leur entourage. There are thousands of appointments available across New Brunswick at RHA clinics and at pharmacies for people to get their boosters and to get vaccinated if they haven't already. Restrictions will continue to get loosened further moving forward, and those who have not chosen to get vaccinated will remain at the highest risk of becoming seriously ill or hospitalized. As we have seen throughout this wave, those are people who are also at the greatest risk of dying. Please book your appointment or attend a walk-in clinic and help us as we continue to open in this province. We don't want to leave anyone behind. We want everyone to be part of the solution to bring New Brunswick back to a normal way of life. We are still considering ways that may encourage people to get vaccinated who have so far not seen a reason to do so. Entre-temps, nous continuons de demander aux gens de se faire vacciner et de recevoir le dose de rappel dès que possible, parce que nos données concernant les hospitalisations ont démontré que le vaccin est notre meilleure défense contre le virus. The move to level 3 also gave us the time required to ensure we were in a position to appropriately deal with the rising case numbers and hospitalizations that we knew were coming, while providing as much support to our hospitals and healthcare centers as possible. This has included increasing vaccination appointments and providing additional options for primary care services so individuals do not need to go to the emergency room. Merci aux nombreuses personnes du Nouveau-Brunswick qui se sont portées volontaires pour aider au niveau de travail clinique et non clinique partout dans la province. Votre aide permet d'améliorer la situation. So far, 3,700 people have signed up, and approximately 30% have been contacted with the goal to match those with experience and skills where they are needed most. As well, through the creation of a pool of 160 emergency long-term care beds, we've been able to temporarily move patients waiting for placement in long-term care homes, freeing up hospital beds and creating more capacity in our healthcare system to meet the needs of those who are seriously ill. I wish to thank all of the people that have stepped up and the many people in the system that are doing extra work to make things happen, to prepare our hospitals to meet future challenges. The last 2 weeks also gave us the time needed to install 2,000 portable HEPA filters for classrooms in 60 schools in the province, which will help ensure a safe return to in-person learning with students. Thanks to the steps taken and the progress made, Public Health has recommended and Cabinet and COVID Cabinet have agreed to move New Brunswick to the Level 2 phase of the winter plan, effective tomorrow night at 11:59 p.m. Dr. Russell has explained why we are comfortable making these changes 2 days earlier than forecasted. We have also examined our Level 2 phase and have made some adjustments. For public gatherings in venues, the restriction of 150 limit added before New Year's celebrations has been removed. Venues will be able to open with 50% capacity, proof of full vaccination, and physical distancing of 2 meters. Patrons must remain seated and masks must be worn unless actively eating or drinking. As we promised last month, we have also made changes to reduce the restrictions surrounding sports and activities at Level 2. Nous reconnaissons l'importance pour les enfants de pouvoir participer à des activités organisées, car elles sont importantes pour le développement et la socialisation, mais aussi pour la santé physique et mentale. That is why, with the return to Level 2, children under 12 will be permitted to participate in individual skills and drills for sports as part of a single team or consistent group with competitions or games. With up to 25 athletes will be permitted for low contact and individual sports, such as curling, figure skating, and tennis. For low contact and team sports like hockey, basketball, and ringette, those 12 and over, 2 teams will be permitted to play each other in a single day, and competitions of up to 50 athletes will be permitted, but no tournaments are allowed. Also, for those 12 and over, no tournaments or competitions are allowed for close contact sports like mixed martial arts, karate, and boxing. Les séances d'entraînement et les autres activités seront permises. Les ligues universitaires et semi-professionnelles sont autorisées à reprendre leur activité selon les protocoles établis et avec une capacité de 50% des spectateurs. The difference in measures between those under 12 and those over 12 is that those over 12 have had time to receive both doses of vaccines, while those under are just starting to receive their second dose now. As vaccination rates improve, we will look at ways to further loosen restrictions around sports for those under 12. We encourage families to vaccinate both themselves and their children to allow us to loosen restrictions more quickly. It's not just about sports, of course. Organized non-sport group activities and music group activities for up to 25 consistent participants are permitted with masking and physical distancing. Concert and competitions are also permitted, but at this time only for individual performers. More information about these changes and all Level 2 measures is available online at gnb.ca under Living with COVID-19. With the return to Level 2, in-person learning will resume at schools across the province this coming Monday. Toutes les précautions nécessaires ont été prises pour assurer un retour à l'école sécuritaire pour les élèves. Et les éducateurs dont l'ensemble du système seront réfléchis selon les besoins pour apporter une plus grande stabilité aux élèves lors du retour en salle de classe. Earlier this week, Minister Carty went through some of the changes that have been implemented. More information about the guidelines surrounding the return to school can be found online under Healthy and Safety Schools on gnb.ca. Level 3 was tough for so many, including our small business owners. Je sais que la vaste majorité d'entre vous ont respecté les règles tout au long de cette pandémie. Vous avez fourni votre part d'effort. I hear what you say when you say that you want your customers back, you want your patrons, you want sales, you want the ability to make a profit. Our government is committed to doing all we can to avoid shutdowns like we have just experienced. Because we are moving to Level 2, we will be moving away from the daily news releases. Data will still be available on the dashboard, and it will be updated daily. It's because of the individual actions of most New Brunswickers that we are in the position to lift this lockdown earlier than expected. Every day we are learning more about how to coexist with COVID-19. Yes, there will continue to be cases, and a small percentage of those will require hospital care. But we have the tools available to help us live with this virus today and in the future. But the tools are only effective if we use them and we follow public health measures and get vaccinated. En fournissant les efforts nécessaires pour vous protéger et pour protéger vos proches et votre communauté, vous contribuez à améliorer la situation. Tout le monde, à quelque exception, a fait ce qui était demandé pour nous aider à lutter contre la pandémie dans notre province. With your continued assistance, we will be able to continue on the path we are on, a path that has taken us back to Level 2 and will allow us to continue to remove restrictions and get back to the lives we all want, a continuous path of finding life more normal, even though COVID is still with us. Thank you. Merci.
Merci beaucoup, Monsieur Premier Ministre et Dr. Russell. Thank you, Premier Higgs and Dr. Russell. We'll now proceed with questions from members of the media. Each reporter will have one question and a quick follow-up. You have the right to pose your question in the official language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi. Travis Fortnum with Global TV.
Hi there. Perhaps this might warrant hearing from Premier Higgs and Dr. Russell. I'm wondering why we're loosening these restrictions early. Looking at the data, it doesn't really seem like the impacts of Level 3 restrictions have surpassed our original best case scenario. So why make them move 2 days before the original timeline?
He asked for both of us, so.
So if I start off with that, the point of looking at getting hospitalizations under control was the focus. And the request from the very beginning was 2 weeks in order to make that happen. And we did that at the request of, obviously, the health authorities, the CEOs, public health, and the recommendations of what it would take to see the curve bend and we see hospitalizations start to decline. We also did that because we had such a high number of people that were out, either through contact or through contacting the virus or contact with others. We've seen a stabilization in that, a stabilization that the CEOs as well as, and Dr. Russell will obviously speak for herself, in relation to what it will look like going forward. Although we expect the cases to go up, we expect the actual hospitalizations will likely increase, but we do feel a renewed confidence in to be able to manage that. There's also the balance of what we've seen with, I would say, actions in relation to people getting really tired of COVID, also with getting their schools back, getting team sports up. So there's a shared responsibility here into following the rules to continue to manage this, and then having a life that people will indeed say, okay, this is reasonable. I can continue to do my part. So it has been a balancing act from the start, but I think, you know, through it all, we've certainly seen a renewed interest in the restrictions being more and more of a burden on society, more and more of an issue in relation to mental health and well-being. So it continues to be, are we okay? Have we achieved our goal? And the 2 weeks would be up on Friday night and at midnight. And the recommendations that certainly we were seeing and discussed would suggest that we can manage it going forward.
And I'll just add to that. So we did achieve what we were hoping to, which was we wanted people to reduce their contacts by 30%, and that is what we're seeing in terms of how the curve is playing out and how that translates into hospitalizations. The trend in terms of the 7-day average, it's trending downward, which is what we were hoping for. We have delayed the peak, but we've also hopefully decreased the peak. And those were also two of the goals that we wanted to do while the healthcare system continued to work, both regional health authorities working very closely together along with social development and Ambulance New Brunswick and extramural to really pull together what needed to get done within the system in terms of redeploying resources, et cetera. It's given us time to get more people vaccinated and boosted, which is really important. When people talk about Omicron being mild, that's a bit of a misnomer. It might be mild if you're boosted, but it's not. There are still people that are going to be hospitalized, and again, the more people that are boosted with that third dose, the fewer hospitalizations we would expect. So again, that gave us time to do that. It gave us time to do the work in the schools that needed to be done so that when kids do go back, again, more kids are vaccinated, more teachers are boosted, and the whole entire school system in terms of the protective measures that they were looking at putting in place had time to have that done. Getting the volunteer list going and having that be another resource to help offset the demands on the healthcare system in terms of healthcare workers being out for COVID reasons. So we've accomplished all the goals we set out to do, and that's what gave us the confidence to be able to go early, knowing that if people adhere very closely to level 2 restrictions, then that's what's going to help us continue in terms of keeping our hospitalization numbers low and being able to get through this wave in the best possible way from a hospitalization perspective, but also from the balance in terms of people's mental health, their ability to earn an income, and children's education.
Thank you. Mr. Fortnum, do you have a quick follow-up?
Yeah, Dr. Russell, you mentioned that we've delayed the peak. Wondering if you might have an idea of when we would hit that or how bad it will be.
Well, we are expecting the peak to be around the middle of February, but these are just projections and we can't guarantee 100% that that's what's going to happen. But with the information that we have today, with the modeling that we have today, we are expecting the peak to happen around mid-February.
Thank you both. Margot Castader avec Radio-Canada.
Oui, bonjour. J'aimerais reprendre ces points en français, s'il vous plaît, Dr. Russell. Pourquoi donc lever les restrictions si vous dites que on va voir quand même le nombre de cas augmenter, les hospitalisations encore augmenter, juste revenir sur la balance là que vous avez faite pour alléger les mesures dès à présent.
Exactement. Alors, quand on a prévu le nombre de cas qui seraient hospitalisés 2 semaines passées, on croyait à ce temps-là que ça pourrait être environ 220. Aujourd'hui, on pourrait dire que si on n'avait rien fait, ça aurait pu augmenter à 220 cas hospitalisés en même temps. Mais à ce moment-ci, à cause de le fait que la population a réduit leur contact étroit par 30%, ça nous a donné la confiance que non, on n'aura pas un nombre si haut de gens qui seront hospitalisés. Et avec des discussions et beaucoup de travail avec les réseaux de santé, tous les deux sont plus confiants qu'ils pourraient gérer le nombre de cas qui sont prévus à ce moment-ci parce qu'on a réussi à diminuer le pic et on a un délai à ce temps qu'on va arriver au pic.
Merci. Et donc, la gestion se fait bien avec les réseaux de santé, même s'il y a encore des dizaines, voire des centaines d'employés qui sont d'employés de la santé des hôpitaux qui sont en isolement?
Oui, exactement. C'est quelque chose que on a travaillé très prochement avec les réseaux durant les dernières semaines pour gérer les situations dans chaque hôpital et avec la situation des ressources humaines dans chaque hôpital au niveau de le nombre qui sont à la maison en raison de COVID. Et à ce moment-ci, on a engagé des volontaires pour aider dans les situations et des endroits qu'on pourrait les utiliser. Et en même temps que tout ça se passait, on a réussi aussi à donner plusieurs gens des vaccins, des doses de rappel, les enfants, les plus âgés, etc. Alors, on sait qu'il y a beaucoup de travail qui a été fait durant les 2 semaines qui vient juste de passer et aussi le travail qui a fait au système scolaire aussi pour faire certaine que la planification était là pour opérationnaliser les plans pour améliorer la protection dans les écoles aussi.
Merci beaucoup. Andrew Waugh with Brunswick News.
Thanks, Bruce. So this is a question to both Dr. Russell and the Premier. So the criteria on your government's website is that 7-day average of hospitalizations needs to be going down and new cases needs to be going down in order to trigger a discussion from level 3 to level 2. Well, neither of those things happened. So I guess my question is why do you seem to be ignoring your own rules? And why would New Brunswickers have any faith in any future rules you set, given that you seem to be okay with ignoring them?
Do you want me to start? Okay. Hi, Andrew. So as you mentioned, and you're correct, these are triggers for conversations in terms of assessing the risk. And our triggers are really about going into more restrictions versus coming out of those restrictions. Coming out of the restrictions, it's about trends, and our 7-day average new hospitalizations per day, 7-day average is trending down. And again, in this particular case, we knew that that this would be delaying the peak, and it would be delaying and it would be reducing the peak potentially. And so both of those things combined, along with the discussions that we had with the RHAs around what they could continue to do with respect to their human resource issues and limitations with so many people being off for COVID, that 2-week period did allow us to start recruiting volunteers. It did allow us the time to increase people, the percentage of the population with boosters, because the booster doses are what keeps people out of the hospital. We have lots of data to demonstrate that. So every incremental improvement in all of those areas is cumulative and very, very beneficial in terms of what we have to face moving forward. That's not to say that we're not going to see more cases. That's not to say we're not going to see more hospitalizations. We just won't see them to the level that we anticipated prior to putting those those measures in place for the last 2 weeks.
And if I was to add to that, I would just say that simply, the people that are following the rules and getting vaccinated and getting our position where our kids are back in school and get back in sports, I think we're increasingly questioning, well, why get vaccinated? I'm not able to do anything more than someone else who's not. So I think it's important that, there is a benefit to doing your part and to ensuring that you're not going to be a risk to others and that your kids can get back to enjoy a freedom that they otherwise were not. So, as you can recall, it's never easy to lock down our society, and it's not the society we're built on. So Dr. Russell clearly explained the medical reasons and all of the conditions that were assessed to allow this to move forward. But the additional part of it is that people need to be able to, who are following the rules and getting vaccinated, be able to enjoy that and get their kids back to living as much of a normal life as possible.
Mr. Waugh, do you have a follow-up?
I sure do. So, Premier, this will be the second time New Brunswick's put rules in place and then dropped them earlier than they said they were. Last time that didn't work out so great. Are you worried that this might backfire?
You know, Andrew, if I was going to spend my time worrying in this job, I guess I'd spend a lot of time doing that. All decisions are based on the information that we have available and working with the professionals that I've worked with from the beginning. I've said from the very beginning, too, that, you know, we've worked well as a team and we'll continue to do so. And we'll make decisions based on the right next step for our province as we can work that out together. So, you know, I think we always must look forward as to the situation at the time and where we're going. And we feel that we are able to manage this going forward, as you've heard. And so it's a balancing decision of what's the right thing to do for people in the province so that we can continue to move forward. I think, you know, just to reiterate, people are becoming increasingly tired of COVID, which makes it even more difficult to follow rules and regulations, which makes it even more of a risk of getting having situations where the problems becomes, let's say, very difficult to manage. So it continues to be a balancing act, but I think this we're striking the right balance and we're doing what people expect. When conditions improve and when we're able to manage the situation, we give more freedoms to reward those that are following those rules.
Thank you both.
Thank you.
Cédric Thévin avec l'Acadie Nouvelle.
Bonjour, une question pour Madame Russell. J'aimerais savoir combien d'hospitalisations on attend pour le pic prévu mi-février.
C'est une très bonne question. Ça va vraiment dépendre si les gens continuent à suivre les directions de santé publique numéro 1 et numéro 2, s'ils continuent à augmenter le taux de vaccination, soit la première dose, la deuxième dose ou les doses de rappel. Si les gens du Nouveau-Brunswick continuent à suivre ces deux directions-là, ça veut dire que au lieu d'avoir un pic de 120 à 140 cas hospitalisés, ça serait plus ou moins environ 150, 160 cas hospitalisés. Et quand on a des discussions avec les réseaux de santé, tous les deux avaient la confiance dans le système comme tel qui pourrait gérer un nombre de cas comme ça hospitalisés. Et aussi, avec la modélisation, c'est jamais exact. C'est quelque chose qu'on essaie de prévenir avec toute l'information qu'on a aujourd'hui, mais c'est vraiment d'avoir confiance dans la population, de continuer à suivre toutes les directives qu'on donne aujourd'hui. Et à ce moment-ci, le nombre de cas qui sont protégés ou non protégés qu'on voit dans l'hôpital, on peut voir que c'est vraiment important que la troisième dose, la dose de rappel, c'est la meilleure protection contre Omicron pour éviter d'être hospitalisé.
Monsieur Thévin, as-tu une suivi?
Oui, pour Monsieur Higgs, il a dit que c'était important que les gens vaccinés puissent profiter de leur vaccination, des efforts qu'ils avaient faits. J'aimerais savoir si c'était important pour lui d'essayer de mettre des règles pour forcer davantage ceux qui ne sont pas vaccinés à l'être.
Well, it may be a need to go further in that regard. I think that what this does is allow us and those that are vaccinated to participate, you know, whether it be restaurants, whether it be sporting events, whether it be, you know, activities that otherwise weren't even open to anyone, now are open to those that are vaccinated. So I would say that there's a big advantage to being moving forward to opening, because that already differentiates the value of being vaccinated versus not. I also, continue to look at that, 70%, in some cases higher, 80% of the situations we have, including death in our hospital, are related to those that are unvaccinated, and many obviously with other factors, but not all. Many that do not have other factors that are still at the high percentage of death that were not vaccinated. So, I think the message here is that as a province, we have to get on with life. And I don't want to leave anyone behind in this process. And that means we need people to get vaccinated so they're part of the process and they are protected. But we can't continue to hold back all of those who are saying, well, why bother? Because they did bother. And they are making the difference. And they are the reason that we're able to move the next step. And I think doing so in a couple days earlier, but still having the 2 weeks that was requested to get things under control, which now, we'll see additional cases, but feel we can manage the hospitalizations. It's just that indication that, you can choose not to get vaccinated, and your family, your grandparents, they will be at risk. But we have to move on as a society. And I really don't want to leave people behind. Do your part. Don't risk yourself and others. But we just can't wait to hope for that. We have to get society moving again.
Thank you. Jacques Poitras, CBC.
Hi, Bruce. You can hear me?
Yes, thank you.
Premier, you're talking about rewarding the vaccinated, but with the unvaccinated, you talked about the Quebec quote-unquote health tax. You talked about requiring proof of vaccination at more places like liquor stores. You even talked about making vaccination mandatory. And people pay attention when you throw these ideas out there and we report on them. And I guess I'm wondering why you put these things out and we don't see any of it. Should we not pay as close attention to these ideas that you put out?
Well, there are lots of considerations of what will be required, the next steps. And I guess those are still being looked at. So we still have a report coming forward to understand the impact that those will have and analyzing what others are doing. There's been lots of discussion about, whether the health tax will have a impact or not, or whether it's even being able to be put in place. The point of being able to open up, though, is like a positive reinforcement for those that have been vaccinated and to give them more freedom. So the more we can open up in areas that require vaccinated people, the same impact can be had. If we have to go further, those items are still being identified and listed and understanding what the impact is to do that. It becomes a little more complicated with the third dose. And then are you fully vaccinated? You haven't got your third dose. Is it 6 months? Is it 5 months? Is it 7 months? So then it becomes a little more complicated in assessing that. And, you need to have maybe a system in place that makes it easily identifiable. But we will always consider, and there are many times, I will talk about things we're considering as part of the discussion. I could leave out things that we consider just to say, well, I can't really talk about it because it's not implemented. But I think people need to know that everything is on the table for consideration. And I've always been that way. There's always been lots of things that you or others could react to that I might speak of that I'm considering because, not everything that one considers comes to fruition, but oftentimes it can.
Thank you. Mr. Poitras, follow-up?
You said before these restrictions that you were hesitating because you didn't think people would follow the rules. Last week you said they were working because people were following the rules, and now you're saying you don't think people will follow the rules much longer. Didn't people show over the last 2 weeks that they did follow the rules? That is what you said last week.
Well, what I said is that we needed, in order to get our hospitalizations under control and to make sure that we would be able to manage it, because it was all about hospitalizations. I think, Jacques, we've all seen significant evidence of people not following the rules. I think the majority have, and we're in the position we're in, but not all. And there's been, I would say, more open defiance of late than we've seen in the past. So there've been a lot of people that have been very compliant. 400 people that were down in town, Fredericton. Do you think they all were unvaccinated? I rather doubt it. But I think people are absolutely tired of COVID. So when you try to balance that, you know, we can all think that we're in a society here that will be 100% compliant. But I think we all know that it isn't, and we all know that it's impossible to enforce the rules in every corner of this province. So when you do what people can see makes sense, in other words, our hospitals are getting better to be able to manage this. It doesn't make sense that my child is all vaccinated and can't play hockey. You know, and you just go on, and people say, well, that makes no sense to me. Well, it becomes more of an issue that people can say, well, if it doesn't make sense or it's not common sense, then they find a reason why, well, maybe I don't need to follow that. And we're at I think a breaking point in that sense. So that's the nuance that we're trying to balance.
Thank you. Laura Brown with CTV.
Hi there. I'm wondering if, maybe just to clarify, did Horizon and Vitalite, I guess, give the okay? I know they were the ones to ask or request for level 3. So are they okay with this?
Yes, Laura. The conversations that we've been having, I mean, we've been meeting more than twice a day with the RHA CEOs and members of their management team for weeks and weeks now. Again, seeing what all the possibilities were to continue to manage the number of cases and hospitalizations that we expect to see with these measures that we've implemented, and then with the removal of the measures.
Ms. Brown, do you have a follow-up?
I'm also wondering if you can tell me how many locations the prompt team is at currently, and how many long-term care homes, and if any deaths have been related to an outbreak at a long-term care home.
We get updates from social development almost daily as well, and my understanding is that during this wave, there have only been 12 deaths associated with nursing homes from COVID. That was the most recent number I received. In terms of outbreaks within the long-term care facility system, I'm just going to see if I have that in my notes. The prompt list, there are 58 sites, not including First Nation sites, where prompt is assisting right now, and social development reports 65 active outbreaks.
Thank you. Vicky Hogarth with CHCO TV.
Thank you, Bruce. My question is for both Premier Higgs and Dr. Russell. Over 40% of eligible New Brunswickers have had their booster, which means that the majority haven't. And we've heard from some New Brunswickers who don't plan on getting boosted. Are you concerned that the booster rollout isn't going as smoothly as planned? And do you have any plans to change the definition of fully vaccinated to include booster doses soon? This is something you're already doing in terms of hospital numbers and accounting for patients. So when will that be reflected in vaccine, I don't want to say passports, but to use vaccine papers to go to restaurants and whatnot?
Do you want me to start, Premier? Hi, Vicki. So basically, the best protection is having that booster, again, against the Omicron variant and against being hospitalized with the Omicron variant. So whatever we can do to increase that, and again, the last 2 weeks with these measures in place, and you know, coming back to our conversations that we've had with the regional health authorities when we talk about what they can manage moving forward. They can only manage moving forward if people continue to step up and get vaccinated and get boosted, and they can only continue to manage if people continue to follow the measures very, very closely. We're saying a household plus steady 10, but obviously if you can reduce that even more, great. I think people have done an amazing job of following the rules, and I think even from JPS, they've even talked about compliance in terms of businesses, et cetera, being compliant at about a rate of 98% was the latest number they gave. And so we have to continue on that same path to continue to see the outcomes that we want to see with respect to hospitalization numbers and the ability of the healthcare systems to continue to manage those numbers.
Ms. Hogarth, do you have a follow-up?
I guess just more to that point, I'm wondering if we will need that documentation to go to restaurants like we have with our, our double vax. Will it be a triple vax necessity in the near future, especially as we move to level 2 and see different retail outlets open. And I'm also wondering if people who are under 18 at this point in time, who've had 5 months since their second dose, will be eligible soon, especially with schools reopening.
So we're having these discussions at the federal level with Public Health Agency of Canada and our counterparts across the country, as well as waiting for recommendations from NACI. So there is actually a meeting today to discuss what is coming up around boosters for the 12 to 18 age group, or 12 to 17 rather. So you'll be hearing more about that probably in the next week.
Thank you. Mathieu Papillon avec Radio-Canada.
Oui, bonjour. Ma première question est pour le Dr. Russell. Dans la balance des inconvénients là, qui guident vos décisions toujours, à quel point le poids des mesures sur la santé mentale pèse plus lourd qu'avant?
Vraiment quelque chose qu'on donne la considération. Les conversations, les discussions que j'ai avec mes collègues, les autres médecins hygiénistes en chef, tout alentour du pays, les effets secondaires, les impacts négatifs. Il y a des recherches qui ont été faites sur les effets sur les élèves, les étudiants. C'est vraiment évident. Les ressources qu'on donne maintenant pour la santé mentale et les addictions, c'est une réflexion une augmentation des besoins. Alors, c'est vraiment quelque chose qu'on considère très fortement.
M. Papillon, as-tu une deuxième question à suivi? Très rapide.
Oui, pour le Premier ministre. Monsieur Higgs, la situation se stabilise donc. Si vous n'avez pas imposé de mesures supplémentaires aux non-vaccinés déjà au plus fort de la crise, est-ce qu'on aurait raison de penser que vous ne le ferez jamais finalement?
No, absolutely not. You can't think that. And when you say going to normal, level 2 is certainly not normal for an unvaccinated individual, because many of the requirements for participation require vaccination. So what we have done is basically focused on letting vaccinated individuals actually get back to a more of a normal life. But for those that are unvaccinated, it only differentiates that there is an added social benefit to being vaccinated in addition to a health benefit, and that your likelihood of surviving it is much higher if you're vaccinated.
Thank you. Merci beaucoup. Marie Sutherland with CBC.
Good afternoon. My question's for Dr. Russell. It looks like you will now be going with new hospitalizations per day as a metric, and given that you're not going to be releasing the daily reports anymore, will that metric now be on the dashboard?
I'm not sure what's going to be on the dashboard. I can get back to you on that. And in terms of what we're going to be monitoring, certainly the daily hospital new admissions is really an important indicator. It is a lagging indicator, but we won't have the most up-to-date accurate data on case numbers because of the switch to the POCT and PCR combined reporting and testing. But yeah, I'll have to get back to you on what's going to be reported on the dashboard.
Ms. Sutherland, do you have a follow-up?
Yes, also for Dr. Russell. New Brunswick was expecting to receive its first shipment of Paxlovid, the antiviral pills, last weekend. Just wondering how many we received, if we did receive them, and what role this treatment is playing in projections and plans to manage COVID going forward.
Well, my understanding is we were supposed to have received 700 this week, and they are ready to be deployed with pharmacists' involvement and family physicians and specialists. And the RHAs obviously are going to be part of that rollout and management, and prioritization has been decided on with respect to who is eligible and who will get it. The goal obviously is to prevent hospitalizations with that medication, but we really aren't counting on it or factoring it into new hospitalization numbers at this time, because the number of doses right now per capita per province that's being distributed is just really a really small amount. So as the numbers increase in terms of the doses that we can get, we can start to factor that in. This medication isn't for everyone. It's not a panacea. It has many side effects and drug-drug interactions, and so the evaluation for those high-risk individuals will be something that's carefully adhered to and considered when prescribing it. And again, there's other limitations in terms of, how many days after symptom onset that you need to be prescribed it. And again, until somebody's prescribed it, and if they've met all the criteria, they still could have, either side effects or they don't tolerate it, et cetera. So we have some work to do moving forward. But it's only a very small part of what we expect to contribute to decreasing hospitalizations at this time. The biggest protection is getting your booster dose. So people who aren't vaccinated, get your first dose. If you have your first dose, get your second dose. If you've got your second dose, get your booster. And that's what's going to protect our hospital system at this time.
Thank you both. Isabelle Legier with CBC.
Can you hear me?
Little louder, please.
Hi, can you hear me okay?
Yes, thank you.
Great. For Premier Higgs, what will you be watching for to determine when or if you'll reimpose level 3 restrictions?
Well, certainly the triggers that were outlined before to go move to level 3 would be monitored, and not only by me, obviously, but more closely by the health professionals and public health. The whole measurement requirement was really focused on hospitalization, because we realized that with Omicron, the case counts were going to go high, and it was about who's going to end up in hospital. So that'll continue to be the trigger in our ability to manage hospitalizations throughout the province. So it'll be the main focus, as it has been, and but I guess I would like to say, and one can never say never, but obviously going to level 3 this past 2 weeks was not easy on a lot of people. And maybe being in January helped, but let's hope we can keep moving forward. And I know that the public health are working with the their national colleagues, as well as our health authorities here, to look at and what we kind of phrase as a glide path out of COVID, and how we can gradually improve living conditions and lifestyles, because we can continue to open up. So, the hard and fast maybe can be moved along, and as we can see those opportunities with different venues, let's hope we can just continue to move. And so that's what's being worked on over the next week, 2 weeks, 3 weeks, to try to identify, how can we move directionally towards level 1 and beyond. And that's let's hope that's our direction, not going back to level 3.
Ms. Legier, do you have a quick follow-up?
Yeah, for Dr. Russell, there's no information on the dashboard about whether people die from Omicron or with Omicron, but from something else. We're told the infection is more mild for vaccinated people, but 44 people have died in 13 days, including people in their 40s, and 6 deaths reported yesterday alone. Can you provide an explanation for why so many New Brunswickers are dying from this disease, and were these recent deaths Omicron cases?
I don't have the breakdown of who passed away from Delta or Omicron, but I believe that a large number would have been Delta in terms of the date, so however early they were diagnosed and hospitalized. Some people, so we have data on how many people were vaccinated, 1-dose, 2-dose boosters. We also understand that people have, in New Brunswick, we have an aging population. We have a population that has chronic medical conditions at a higher rate than other jurisdictions. So those two things combined means that we will see probably a higher number of deaths. So in terms of the protection that people need, if you're triple vaccinated and you're over the age of 50, the risk of being hospitalized and having complications and dying are very low, but they increase if you have chronic medical conditions the older you get, and if you're not vaccinated. So younger people who aren't vaccinated can also have severe symptoms and severe outcomes. And so that's why right now, moving forward, to protect the hospital system as much as we can, we need everybody who can get vaccinated with their booster shot to get it. If you haven't been vaccinated with your first dose, get your first dose, get your second dose if you can, and your booster. So that's what we need everybody to understand, that it's not 100% protection, but it's the best protection we have.
David Coach with CHMA. Oh, sorry.
I was going to just add to that in relation to the information Dr. Russell provided. Those that over the age of 70 with pre-existing conditions have accounted for like 76% of our COVID-19 deaths since December 1st. And those under the age of 70, 86% of those who died were not fully protected or vaccinated. And there will be, and in terms of the dashboard, we do have information now in relation to percentage in hospitals, and there will be information in relation to deaths and the conditions. I think people need to understand exactly, you know, what conditions are at risk. You know, people need to know that's me, or that's my father, or that's my mother, or that's my brother. It's so the facts are clear. Who is at risk? Who's not at risk? And will that heightened awareness? Because it doesn't mean I'm not at risk. It means I might put someone else at risk who I know. So those particular details will be on the dashboard based on who's dying and who is not.
And also, there are some elderly individuals who choose to have their advanced care directives signify that they don't want to be resuscitated, they don't want extraordinary measures. And so again, that's very common practice in nursing homes for sure, and in the population at large. Again, elderly people who give that instruction to the hospital system, they won't be put on a ventilator as an example.
Apologize for cutting you off, Premier. My apologies. David Coach, CHMA.
Hi, for Dr. Russell, what have you learned from wastewater testing in the Moncton area, and will this kind of testing be expanded?
I'll have to get back to you on that. I know we were doing some of that. Some jurisdictions have done it more than we have. So we, I think Northwest Territories has been doing a lot of it, and I feel like Ontario has been as well. But we have worked with Dalhousie University on that. But in terms of any further details, myself or Bruce will get back to you.
Mr. Coach, do you have a follow-up?
For Premier Higgs, any comment on the so-called Freedom Convoy going through New Brunswick today?
Yes, I think what you see is basically a situation where people are tired of kind of restrictions, or tired of this the COVID situation, and a lot of people that are, as I might have said earlier about demonstrating, are not vaccinated or are vaccinated that are participating. I think we can't lose sight of the situation here. You know, we're blessed to be in a tremendous country, and the whole situation we have here with COVID is something that's is out of our control in the sense of how it came about and how it becomes inflicted upon us, and we're trying to manage the best we can through it. It isn't about, you know, trying to restrict people from having their basic rights and freedom. It's about finding a path to protect everyone's health and safety. So let's not lose sight of what the real reason is that we even are addressing health issues, and we're trying to promote vaccinations. It's not about our country, you know, losing our freedoms. We all value that. We all cherish that. And that's why this is such a balancing act. And, you know, I know that in my role, I'll get criticized from whatever direction it'll come from, but it definitely will come from some direction. I'm quite accustomed to that in this job at this time. But we're all doing our best to make decisions on for the most and for as many people as possible, and for everyone for that matter. It's just some look at it differently. So I hope this thing won't materialize to anything more than what it is, a statement that, you know, we're tired of COVID and let's find a way out of this.
Thank you. Nicholas Steinbach, Radio-Canada. Monsieur Steinbach.
Poser sa question, Bruce. Alors, ne quitte pas.
Non, j'ai besoin de Nico.
Oui, je sais. Il est là dans 2 secondes. Désolé, Bruce. Désolé, tout le monde. Il est là. Je le laisse parler.
Ben, je vais passer à quelqu'un d'autre.
Sorry about that. This
OK,
question is for,
vas-y, Monsieur Steinbach.
Désolé pour ça. La question est pour Monsieur Higgs et Madame Russell. Je voudrais savoir, basé sur vos projections, quelles sont les possibilités et basé sur quel déclencheur est-ce que les Néo-Brunswickois peuvent s'attendre à retourner en phase 3 dans le futur?
Moi, je peux commencer, puis si le premier ministre veut ajouter, à ce moment-ci, la modélisation nous démontre que si les gens continuent à se faire vacciner et prendre leur dose de rappel, et si les gens suivent les restrictions de le niveau 2, ça veut dire qu'on pourrait voir des nombres de cas hospitalisés, environ 150-160 patients. Si ça va mal, ça va être plus haut que ça. Mais au commencement de les 2 semaines, quand on avait fait la décision d'aller à la phase 2, c'était vraiment parce que les projections, les modélisations, ça a prévenu qu'on aura environ 220 cas hospitalisés. Et ça, c'était vraiment trop pour la capacité, avec les problèmes avec les ressources humaines et le nombre de travailleurs de santé qui seraient absents. C'était pas quelque chose qui pourrait gérer. À ce moment-ci, on a plus de flexibilité dans le système et on va continuer à travailler avec les réseaux pour faire certaines qui peuvent continuer à gérer la situation au niveau de continuer à être capable d'offrir des services d'urgence et des services de soins intensifs.
Monsieur Steinbach, as-tu un suivi très, très, très rapide?
Oui, je voudrais savoir, merci, que veut dire pleinement vacciné aujourd'hui? Est-ce que ça veut dire 2 doses ou ça veut dire 2 doses plus le booster?
Pour démontrer que vous êtes vacciné pour entrer à un endroit qu'il faut montrer la preuve, c'est 2 doses. Mais vraiment, pour la protection contre le variant Omicron, contre les risques d'avoir des symptômes sévères et être besoin d'être hospitalisé, c'est vraiment 3 doses.
Merci.
Merci.
Don McPherson from the Daily Gleaner. Don?
I guess the system muted me automatically. Can you hear me?
Yes, go ahead. One quick question.
Okay, thank you. I have a question for the Premier. This afternoon, the New Brunswick Police Association sent a letter to Public Safety Minister Ted Fleming and copied you on it, filing a formal complaint against regarding the content of Minister Carty last week in regard to social media activity, commenting on the Fredericton Police Force's message about the Saturday planned protest at that point. Minister Carty criticized the police's approach, seemed to call for a harder line. The New Brunswick Police Association says Minister Carty stepped over the line, and they're asking for an investigation and for him to even be removed from cabinet. I'm looking for the Premier's reaction to that letter.
Well, I haven't had a chance to review the letter in depth. I am aware of it, and I will be talking to the Attorney General to discuss kind of what next steps might be in that regard. I think it's important that I say the comments were truly unfortunate and uncalled for by the minister, and I have certainly. I have had conversations since then expressing my support for the Fredericton Police and their chief and the members, because I believe that we must continue to be strong in support of our police force. So I will review the letter and discuss it with the Attorney General and then be in a position to talk about it at another time.
Thank you both. Merci beaucoup tout le monde. Voilà la fin de notre mise à jour. That concludes today's update. Thank you.